So here's a couple tips before you place the AED on a person that you've deemed unresponsive and have been performing CPR on. The first thing is, in the AED kit, there's trauma shears. You use these shears to cut the clothes off of the person, because the AED will not work unless it's on top of skin, and it won't read the heart's rhythm, and you will not be able to deliver an adequate shock if it's not placed on the skin. Another tool in the kit is the shaver. This is for if someone has hair in the spots where you would put the AED pads. It doesn't take much. You just need to remove enough hair just so the pad can properly be placed on the chest. The reason why is because if there's too much hair, then the pads will not stick to the skin and you will not get a good read and you will not get a good shock. Another thing to keep in mind is if someone drowns. If someone drowns, first they need to be rescued out of the water. Once they're rescued out of the water and you've already started to perform CPR after deeming them not having a pulse or breathing, when someone brings the AED over, you need to make sure you dry them off with the towel before you place the pads on. The reason why is because there is an adhesive on the back of the pads, and if there's water on the body, it will not stick, and you will not get a good shock, and you will not get a good read of the rhythm of the heart.